The question about whether coffee is good for us or bad for us is a difficult one. One week we hear that it's beneficial, another week we hear that a study is saying that it's harmful. And the reason that this debate will never end is because coffee reacts differently with different people. One person's medicine is the next person's poison. And so we really need to take in the person's individualized genetics, their lifestyle, to determine whether or not coffee would be a poison or coffee would be a medicine. But before we get into the criteria list to determine whether coffee is helpful or harmful for you, it's important to understand why different people react in different ways to caffeine. Number one, genetically speaking, there are two types of people. There are fast metabolizers and there are slow metabolizers. This is entirely based on your genetics. Fast metabolizers have high levels of cytochrome enzymes in the liver, and then slow metabolizers have low levels of cytochrome enzymes in the liver. This just means that there are people that remove caffeine quickly from the blood and there are people that remove caffeine slowly from the blood. These cytochrome enzymes are responsible for metabolizing hormones, toxins, cosmetics, prescription medication, cigarette smoke. These are all things that will affect the levels of the cytochrome enzymes that we have available to us. The second thing that's important to understand to determine that or whether coffee is having a harmful or a hurtful effect on us is that caffeine is a stimulant. And this is why people take it. But what that means is that caffeine increases levels of something called noradrenaline or norepinephrine. And this is responsible for increasing memory, increasing focus, increasing circulation to the extremities, removing circulation from the digestive system. It increases anxiety, it increases restlessness, and it increases sweat gland activity. So, two things to remember: fast and slow metabolizers, and that caffeine is a stimulant. Now we can get into some of the criteria that you can use to determine whether or not this is a beverage that is beneficial for you. All right, so let's get into the first half of this criteria list. If you're a coffee drinker and you have some of these symptoms, it's important to ask the question, is there a relationship between my coffee consumption and my symptom picture? Here are some things that coffee can cause. Number one, insomnia. So many of my patients are concerned with their sleep quality. We know that coffee can cause insomnia or restlessness at night. Look at that relationship. Number two, increased blood pressure. We know coffee can increase our blood pressure. Number three, hyperhidrosis. Coffee as a stimulant will increase sweat gland activity. So if you have sweating or are concerned about that symptom, look at the relationship to your coffee consumption. Number four, migraines. Some studies are connecting coffee consumption with migraines and headaches. A simple place to start. Urinary incontinence. We know coffee is a diuretic. It will increase urine production. Number six, gallstones. And one of the common symptoms associated with gallstones is right shoulder pain. I can't count the number of patients I have with shoulder pain. Coffee increases a hormone called CCK, which increases gallbladder contractions. Every time you consume coffee, the gallbladder will spasm. If you have gallbladder disease or gallstones, this is going to cause referred pain. Look at that relationship. And lastly, anxiety. So many people are concerned with anxiety, but we know coffee is a stimulant. Coffee will cause restlessness and anxiousness. Coffee also affects how our body breaks down estrogen. So if you have any signs of elevated or excess estrogen, breast tenderness, heavy bleeding, a lot of cramping, even menopausal symptoms, it can be affected by the amount of coffee you're consuming. Start by asking yourself this question first. Before you explore any other treatments for these symptoms, start with coffee. Because I've certainly had patients that have hot flashes that resolve when they stop coffee, that have heavy bleeding or excessive cramping that when they stop coffee, they resolve. So it doesn't have to be complicated sometimes. We work months and months and invest time and energy in treating these symptoms when really all we need to do is take out this one substance and our body responds. So I would say if you check yes to any of these, insomnia, blood pressure, sweating, migraines, urinary incontinence, gallstones, or anxiety, it's really important to question the involvement that coffee is having with it. And again, it doesn't mean you need to take coffee out, it just means you need to decrease it and see if it improves this symptom picture. Okay, so the second part of the criteria that you want to look at to determine whether coffee is helping or hurting your system are some medications and different lifestyle habits that can increase the amount or decrease the amount that caffeine is running off the body. So the first question is, are you taking warfarin? Coffee decreases the enzyme that metabolizes warfarin. This means more of the medication ends up in the blood if you're consuming coffee. This decreases your need and decreases the potential dose. The next question that you want to ask is, are you on this particular antidepressant medication, fluvoxamine? This is an SSRI. It decreases the enzyme that metabolizes caffeine. So caffeine stays in your body longer, from 5 hours to 30 hours. So you can see that if you're taking this antidepressant and on coffee, it's very, very likely that caffeine will overstimulate you at the end of the day. Are you pregnant? Are you drinking grapefruit juice? These two things as well will decrease the cytochrome enzymes, increasing the effect that caffeine has. Number 4, are you taking Tylenol? Same thing, it decreases the amount of the cytochrome enzyme, increasing the stimulant effects that caffeine can have, the restlessness, the insomnia, certainly the effects, the harmful effects it has on digestion are extended when taking Tylenol and coffee. And the last one is, are you on the birth control pill? The birth control pill decreases caffeine clearance by 40%. Again, this means that caffeine has a greater effect on the people that are consuming coffee. Warfarin, fluvoxamine, pregnancy, grapefruit juice, Tylenol, birth control pill. These are all things that can heighten the effects that caffeine has on your body. You need to be mindful of it. And again, it doesn't mean that you have to take coffee right out. It just means adjust your quantity. If you're noticing, if you're on fluvoxamine and you're getting a lot of insomnia, it's because that medication is lowering your caffeine clearance. You need to adjust your lifestyle based on this information. And then lastly, there are two things to consider in terms of factors that increase your cytochrome or increase your liver enzyme activity. One is a proton pump inhibitor called omeprazole, and the other is smoking. Both of these things will increase caffeine clearance, which means caffeine will have a lesser effect, which means you may turn to more coffee to stimulate the body if you're doing either of these two things. And this can create a problem if you're an adrenal fatigue patient, because you continue to inundate the adrenal more and more and more as a way of getting that same effect. Okay, so at this point, some people may be asking, how do I determine whether I'm a fast metabolizer or a slow metabolizer? And one of the best ways of individualizing your medical care is to have your genetic profile completed. And that can be done at a website called 23andme.com. They take your saliva and they analyze it, they map your human genome, and they give you hundreds of pieces of information about how you can personalize your care. But one of those pieces is whether or not you metabolize caffeine fast or slow. Alright, so the reason why the debate whether coffee is good or bad will never end is because it affects different people in different ways. For some, coffee is a medicine. For others, coffee is a poison. And you can start to see now the criteria list that affects how coffee will shift your body. If you have any questions or comments, I'd love to hear from you, whether you have negative experiences with coffee or positive experiences with coffee. When you take it out, how do you feel? When you put a lot in, how does it affect you? This is not to say that coffee should be taken out completely. It's just some questions or some self-analysis to look at how much coffee can we tolerate without contributing to some of our chief concerns. We'll see you on the next quick tip.